dogs may detect health problems through scent and subtle behavioral changes long before humans notice symptoms. In this video, we'll count down 10 surprising medical conditions dogs may detect before doctors can confirm, and why this matters. 1. Cancer. Cancer can be hard to spot early because symptoms often don't show until later. Trained dogs have been reported to detect cancer by sniffing for chemical compounds released by the body. Those compounds can appear before imaging or lab tests become positive. Even when dogs can't diagnose on their own, an alert could push someone toward earlier screening, when treatment is often more effective and outcomes can be better. What makes this category so surprising is the idea that a dog may recognize a biological signal from the body long before the pattern becomes obvious to people, or before clinicians can identify it using current tools. 2. Diabetes. Diabetes, especially blood sugar swings, can start with mild, easy-to-miss signs like fatigue, thirst, and mood changes. Dogs may alert when scent changes reflect high or low glucose states. What's surprising is the timing. Some owners describe alerts before they realize their condition is worsening, or before symptoms become impossible to ignore. Because blood sugar can fluctuate, a dog might react during moments when the body's chemistry shifts even subtly. That could mean earlier glucose checks and quicker medical response, which is especially important for preventing dangerous episodes. Would a pet alert change how often you check glucose? 3. Hypoglycemia, low blood sugar. Hypoglycemia can escalate fast and become dangerous. Symptoms like shaking, confusion, sweating, and weakness can appear abruptly. Dogs may notice changes in the body's chemistry or stress-related signals before a person feels fully unwell. This matters because there is often a delay between what the body is doing and what a person recognizes. If a dog alerts early, it can help trigger action quickly, like checking blood sugar immediately or getting help before things worsen. Would you follow your dog's alert by checking blood sugar right away? 4. Seizures. Some dogs appear to detect patterns before a seizure. Owners often describe behaviors such as restlessness, unusual attention, pacing, or seeking contact. While this cannot predict every seizure for everyone, it may offer a warning window in certain cases. That warning window can be used to reduce risk. People can prepare the environment, move away hazards, and follow an individualized seizure action plan guided by medical professionals. In emergencies, even a few minutes can make a meaningful difference. Have you seen a dog react before a seizure happened? 5. Heart problems. Heart conditions often build gradually, and early symptoms can be mistaken for stress, poor sleep, or getting older. Dogs may detect scent shifts and behavioral cues related to breathing changes, metabolism changes, or stress chemistry when the heart is not functioning normally. Even if a dog cannot specify the exact diagnosis, consistent alerts can encourage earlier checkups. That can help clinicians catch problems at a stage where treatment may be more manageable and risk of progression can be reduced. What would convince you it's serious enough to call a doctor? 6. Stroke risk. Stroke is usually recognized by sudden symptoms, but some accounts describe pets acting unusually right before a major event. The idea is that brain and circulation changes can alter the body in ways that create scent or behavior shifts before clear signs appear to humans. This is especially important because time matters with stroke care. If a dog's alert helped someone treat the situation like an emergency sooner, it could potentially reduce damage and improve outcomes. The key value is earlier recognition and faster medical attention. If a dog suddenly acted different, would you treat it like an emergency? 7. Kidney disease. Kidneys affect waste removal and electrolyte balance, which can change body chemistry. Those changes can alter odor and breath in ways humans may not notice early. Dogs may pick up on these scent differences and alert to problems before symptoms like appetite loss, nausea, fatigue, or changes in urination become obvious. If an alert leads to earlier testing, like blood work and urine analysis, doctors can evaluate kidney function sooner. Catching issues earlier can improve comfort and help slow progression when possible. Would you get regular blood/urine tests sooner if your dog alerted? 8. Liver disease. The liver processes many chemicals, so when it's not working properly, the body's chemistry can shift, including the compounds that affect breath and body odor. Those changes may be subtle at first, and humans often don't notice them because early liver symptoms can be vague, like fatigue, mild nausea, or reduced appetite. Dogs may detect those differences earlier than people because they react to scent changes that are hard for humans to pick up. If a dog starts alerting more consistently, especially at times when a person feels slightly worse, it can serve as an early signal that something is going on internally. That doesn't replace medical testing, but it can help someone get checked sooner, which is important when early evaluation can make treatment easier and more effective. Do you think pets could help spot problems that humans ignore? 9. Autoimmune flare-ups, inflammation. Autoimmune flare-ups can be unpredictable, and the early stage may feel like an ordinary rough day rather than a clear warning sign. When autoimmune activity increases, inflammation affects the body in many ways, including comfort, energy, breathing patterns, and overall chemistry. Dogs may pick up on these internal changes through smell and behavior. Owners sometimes describe pets becoming more attentive, more clingy, or unusually focused during flare periods. Over time, those patterns can help someone recognize that a flare is starting earlier than they would on their own. The benefit is timing. If you notice a consistent shift, it may encourage earlier care, closer monitoring, and faster communication with a clinician. Have you ever noticed your pet acting different during your symptoms? 10. Respiratory illnesses, including COVID-19 reports. Respiratory infections can alter breath chemistry. When someone is sick, especially with infections affecting the airways, the body may release volatile compounds that can change how breath and body odor present. Dogs have long been known to detect scent changes related to illness, and during the COVID-19 period, there were reports and studies exploring whether dogs can detect infected individuals by smell. Even beyond one specific virus, the general concept makes sense. Illness can change how the body releases chemicals. If a dog alerts to those changes, it can encourage quicker action like testing, isolating when appropriate, and seeking care sooner. Would you get tested faster if your dog alerted to a possible infection? So, what surprised you most? And do you think dogs can detect illness earlier than doctors? Comment your answer and subscribe for more science-backed animal content. Also, share this with a friend who always says my dog knows.